Hey everybody, I hope you all are doing well and welcome back to Michael's Matters. Now, of course, as is the custom, I am Michael, and with a little bit more than a month left in the year and a fair amount of holidays and days off in between, it's apparent that there are going to be a whole heap of changes this year that are going to affect folks on Social Security. So that could be Social Security Retirement, which of course is the majority of folks in the program, but also things like Social Security Disability SSDI, Supplemental Security Income SSI, spousal benefits, survival benefits, and really all the other iterations of Social Security. Everything from increased monthly benefits to increased on taxes to increased earnings and increased Medicare costs. Well, I guess really when we break it down, there's going to be a whole lot of increases this year to come. So today we are talking about the main changes that are going to affect folks on Social Security next year in 2024. Now, before we get to the video, if you like these videos, if you find them interesting, if you find them helpful, or hey, if you at least find them useful, please don't forget to like and subscribe because it does really help the channel to grow and we are so thankful for that. But also because you get updates when our newest and most informative videos become available. All right, now, let's get down to the video. So let's start this list off with the biggest numbers for Americans, retirees, and folks on Social Security benefits, which is going to be for the cost of living adjustment, or COLA, for 2024. Now, in case you haven't already heard about it, maybe you've been under a rock or on vacation, or I don't know, benefits are going to increase by the amount of 3.2% across the board. So that is for whichever version of Social Security that someone actually is on. In real numbers, if we take that examples from the current Social Security benefits, it means that the average person on Social Security Retirement will get an increase of $59.01, bringing the 2024 average Social Security benefit for a retired person up to $1,902.97. For folks on SSDI, so that's Social Security Disability, that would mean that they would get a 47.66 increase, so $47.66, I guess how we say that here in the US, and bring that average benefit on SSDI up to $1,537.13. And for spousal benefits, it would be at $28.39 increase, and SSI would be at $21.65 increase a month. And so that would mean that spousal benefits would go up to $915.66 on average, and SSI on average would go to $698.25 a month in 2024. Of course, these numbers are going to be based off the October average of Social Security benefits, so that's what the base was that got increased, and these numbers will change month by month, so it is still going to be a little bit of a rough estimate of how much a beneficiary will get, and since, you know, it might be different for everybody really, because the 3.2% is a percentage of the difference of anyone's benefits, and those all are different. So these are just averages to give you an idea about how much the average person, whoever is actually average, will get see their increase. Another important thing to mention is that the COLA being set at 3.2%. That means that for every month, as we keep an eye on inflation, every month that inflation is above 3.2%, it means that beneficiaries will begin to start losing actual purchasing power. Currently, though, the most recent CPI report, or the inflation report out from the Bureau of Labor Statistics, which is the government folks who keep tracks of these things, it does show that overall inflation right now is right on track at 3.2%. So it means that nobody on Social Security is losing grounds technically against the current rate of inflation, but that can always change. So if inflation does go back up above 3.2%, though, that is going to hit every month on retirees and folks on fixed budgets on their incomes. Now, another important update for folks on Social Security for 2024 specifically is going to be for those folks who are receiving Social Security and started taking their benefits early. That is before their full retirement age, the FRA, at 66 or 67 years old, depending on when they are born, and they are also still earning income from work. This is a pertinent distinction because of the fact that if you are working and getting Social Security benefits prior to your full retirement age, then for every couple of dollars you earn from work over a certain limit, Social Security will start to reduce or offset your Social Security benefits that you are receiving. Luckily, this number did go up for 2024, so you can actually earn a little bit more, and it went up more than the COLA, higher than the current rate of inflation at 3.2%, so that is a definite plus. But let's talk about the numbers specifically, because there are two different levels of income earnings that you can be on while you are on Social Security benefits. The first is for those folks who are under their full retirement age. So that would be anyone under the age of 66 or 67, the earliest of which can be at 62 years old. That's the earliest that you can start taking Social Security benefits. So somebody at 62 years old, hypothetically, for these folks, they would be able to earn up to $22,320 a year from work. Now, after this point, Social Security will start to remove or offset $1 of a person's Social Security benefit for every $2 of earned income over that $22,320. This new limit is actually about an increase of 5% from 2023, that's this year, where it was set at $21,240. So that is still pretty good because it's going to beat the current inflation rate at 3.2%, and it means that people can work a little bit more and keep a little bit more of the money that they worked for, which I guess is fair, right? Now, the secondary level is going to be for those folks who are within the year in which they're going to be hitting their full retirement age. So if their FRA is at 66 years old, then these folks could be 65 years old and anything less than 365 days old. So within that year before their birthday, because in this one specific year, the earned income limit is going to go up pretty dramatically. And in 2024, that number is going to be at $59,520 a year worth of earned income. At that point, any income that is earned above that amount is going to get offset by $1. So one of their Social Security dollars is going to be taken away for every $3 over that amount that somebody earns, which is actually a slightly bigger increase than the previous folks, for those folks who are under the FRA. This, in fact, is a 5.3% increase, up from $56,520 in 2023. So it is a bit of a bright spot for 2024 because it also means that folks are still going to be beating whatever that COLA or that inflation rate, and they're equal at this point at 3.2%. It means they can also earn a little bit more money, put a little bit more away, and really try to get a little bit more in those savings for their full retirement. The next change up is going to be another increase, but it's not going to be the good kind, which is going to be an increase in the Medicare monthly premium. Now, Medicare is a health insurance program for older Americans who are over the age of 65. So even though Social Security retirement benefits have gone up and will likely continue to go up, Medicare, the age for Medicare, is still at 65 years old. But where the increase is happening is going to be in the monthly cost for Medicare, because for Medicare, there are two parts, Medicare Part A and Medicare Part B. Now, Medicare Part A is usually no cost because the folks who qualify for it usually qualify for it by working the required amount of time, which is 40 quarters or 10 years, and paying into it so that when they do retire, Medicare Part A does not typically have a cost. But the second part of Medicare, Medicare Part B, it does have a monthly cost, and it changes year over year to match with the overall cost for the program. Regardless of how many years you paid into it, you're always going to have a premium. In 2023, that cost for Medicare Part B was $164.90. But for next year, 2024, it's going to increase by $9.80 a month, or 5.9%. This means that on a monthly basis, folks on Medicare at minimum will be paying $174.70 a month. Now, those retirees who are lucky enough to have substantial wealth, this number does go up depending on how much somebody's income is. So it can actually be more than that. But the baseline, the main number for most folks, is going to be $174.70. Also important to notice is that the rate of Medicare increase for 2024, like I just said, was at 5.9%. This, again, is still considerably higher than what the COLA is at, 3.2%, or that cost of living adjustment for folks on Social Security. And in short, what that means is that even though the increase is small dollars-wise, the portion of a retiree's budget, if they're getting Social Security, that Medicare Part B takes up is actually going to increase. It's going to represent a larger part of those benefits being sucked up because it increased by 5.9%, which is a considerably more higher percentage than the 3.2% increase that they're getting in their overall benefits. So ultimately, it does lead to seniors and retirees and older Americans having less money in their pocket, less purchasing power, and less the ability to maintain that independence. So that definitely isn't fair, right, your congressperson, right? Last up today is for anyone who's working, including older Americans, as well as younger ones. So not everybody who is retired, but it does definitely affect retirement, is because the amount of income that can be earned and can be taxed for the purpose of Social Security is going to go up as well. So when we work and we get paid, there's oftentimes a very noticeable difference between how much money we get paid on payday versus how much money actually goes into our pockets. And the reason for this is because of the payroll tax that is used to fund, badly I might add, Social Security. In fact, the total amount of tax is 12.4%, but it is split between us and our employers. So we pay 6.2% and the employer pays 6.2%. But obviously, the way that the structure was planned out was to help those folks who have a lot of money, because this tax doesn't apply to all earnings. It only applies to earnings up to a certain limit. And then it stops for any dollars over that limit. Now, the limit in 2023 is at $160,200 worth of earnings. So all of that money would be taxed at 6.2% for Social Security, which means that if you earn less than $160,200 a year, then all of your earnings are taxed. At that $160,200, that means that the maximum amount of tax paid in would be $9,930.40. This amount is going to go up next year to $168,600. So that's 2024 of 2024 earnings for wealthy folks that will still now be taxed at that 6.2%, which means that the actual total taxable amount of money that would be coming in revenue or tax revenue would be $10,453 in 2024. Now, when we factor this out, this again is a 5.2% increase for next year, which is, I guess, one way to keep Social Security afloat. So overall, the changes for this coming year in 2024 are going to be pretty dramatically different from what we saw in 2023. And by dramatic, I mean, less good. First off, obviously, the increase in COLA for everybody is going to be less, a lot less. From the 8.7% increase they got in 2023, everyone now is getting a 3.2% increase for 2024. Secondarily, the other ancillary costs for retirees and older Americans, things like Medicare, things like inflation, and things like taxation and Social Security benefits are all going to continue to go up, and in most cases will equate to much more collectively than the 3.2% increase that folks got from their COLA in 2024. This really does go to show how the retirement support system in the United States, whether by benign neglect or purposeful intent, is habitually undercutting some of the most valuable and some of the most vulnerable Americans that we have. The worst thing about it is that it is continually happening year over year, to the point that the actual purchasing powers of retirees has been so deeply cut back that Social Security is starting to not even be able to provide the level of support it was originally intended to provide, even if the dollars are correct and the actual ability to buy stuff is not, let alone the fact that by 2035, Social Security may only be able to pay out a maximum of 75% of whatever the intended benefits are supposed to be. So needless to say, 2024 is going to be a much more difficult year financially for those folks who rely on Social Security for a majority of income. And we will really just have to wait and see where the cost of everything actually goes this year to know exactly how short SSA benefits will be for 2024. All right, so that's it for Michael's Matters, and it's a little bit of a gloomy note, but I really hope that you enjoyed this video, or at least you found it interesting or found it helpful. And if you did, please don't forget to like and subscribe, because it really does help the channel grow, and we are so thankful for that. But also because you get updates when our newest and most informative videos become available. So for Michael's Matters, I'm Michael, hoping that you take care of yourself, take care of others, and have a happy, healthy